Case 2. The Bias Blindspot. Here is the situation. A health provider network, MedSure Alliance, launched an AI video coaching app called MentorMed. The app observes doctors' telehealth consultations with patients, giving feedback on diagnostic accuracy and communication skills. The app was trained on videos of medical specialists worldwide and on patient conversations in multiple languages and accents. Each physician provided their age, gender identity, and race during registration. Patients consented to recording in exchange for preferred appointment scheduling. After 1 year, MedSure reviewed the MentorMed program. Surprisingly, MentorMed was 2.5 times more likely to provide negative feedback on communication to women doctors, and 3.5 times more likely for women under 40. In addition, MentorMed was 4 times more likely to question a doctor's diagnostic accuracy when the patient spoke with a Spanish accent. As a result, the AI gave the toughest development goals to doctors who were both female and practicing in neighborhoods with Spanish-speaking patients. Here are the challenges. At a leadership meeting, MedSure's CHRO argued that MentorMed is biased and should be discontinued, warning that MedSure risks losing young physicians. The General Counsel reminds the leadership team that even unintended algorithmic bias can create exposure under the Affordable Care Act if the tool's outcomes differ by gender or ethnicity. Compliance agrees, saying disparities in physician performance by gender could trigger mandatory investigations. However, the Chief Medical Officer wants to keep MentorMed online, citing patient safety. If MentorMed finds and fixes gaps in diagnostic accuracy for even one patient, then it is protecting patients and saving lives. The medical officer argued that younger physicians, regardless of gender, need to learn to handle negative feedback. Furthermore, the MentorMed issue is spilling into the public eye. Patients are asking if their consent was truly free, if it was tied to scheduling advantages. On the one hand, keeping MentorMed could damage trust with younger physicians and expose the organization to reputational risk. Yet discontinuing MentorMed is also risky. Patient advocacy groups claim that MentorMed is an essential part of patient safety for vulnerable populations. With millions of dollars invested, the MedSure leadership now must decide what to do. Key questions for your group discussion. What ethical issues does this case raise? How should MedSure balance patient safety and fairness to employees? If you were advising MedSure's leadership team, would you recommend discontinuation, reprogramming, or full adoption of MentorMed, and why?